Yeah, so the role I think of radiotherapy in HCC continues to evolve. There is the techniques that are internal, such as yttrium radiotherapy, and those that are external. And there certainly is a lot of worldwide interest in the internal radiotherapy, such as yttrium radiotherapy. And I think the other external radiotherapies also have a lot of compelling information and data that is being published. And I believe that in the future, radiotherapy techniques, no matter how they are applied, are going to become an essential part of treating HCC. The advantages of the yttrium radiotherapy is that it is internal, in that you are injecting the radiotherapy directly into the tumor, so there is no effect on adjacent tissue. And that is a big advantage compared to other modes of radiotherapy. So yes, guidelines do talk about resection, transplant, and ablation for small lesions. The problem, of course, is other factors come into play in terms of resectability, the location of the lesion, the comorbidities of the patient that may or may not allow surgical resection, and of course ablation is dependent on where the lesion is located. So radiotherapy with Y90 allows you to identify the blood supply to these lesions and apply a very high dose radiation therapy. And there are hundreds of research reports that have published on this. There was a 1,000 patient paper that we published in Hepatology several years ago. And there are now many centers in Europe that have adopted this technology as within their toolbox of HCC. So when it comes to HCC with tumor thrombus, yes, there's a high risk of recurrence after surgical resection, and that is why, indeed, the combination therapies are the best. For my approach, I believe that the yttrium radiotherapy, because of its internal delivery, is a very good tool to treat the venous tumor thrombus and then apply systemic therapy to augment and to improve the response of the radiotherapy. So I think there are many studies that are ongoing that will continue to improve this, and this is data that I think that will be coming out in the coming years. The challenges of radiotherapy in HCC have to do with the cirrhotic liver, the background disease, and exposure of radiotherapy to other organs. When it comes to internal radiotherapy with yttrium, though many of those risks are in fact mitigated because the radiotherapy is being inserted from the inside out, and that is one of the major advantages of the radiotherapy. In terms of advanced liver cancer, particularly locally advanced with portal vein thrombosis, certainly the yttrium radiotherapy and other types of radiotherapy, I think, play a role in debulking and decreasing the amount of tumor thrombus. And these are often married to other types of therapies like systemic therapies to achieve sort of long-term responses and hopefully extend patient survival.